Abdominal discomfort is one of the most common reasons people seek medical attention, but many assume that any pain in the belly must originate from the stomach or intestines. While digestive organs often do play a role, the abdomen houses many other organs, tissues, and structures, each of which can be a source of discomfort. Understanding the broader possibilities is crucial because treating the wrong presumed cause can delay proper care, and some conditions may require urgent attention. I'm Dr. Austin Chang, a board-certified gastroenterologist, and today I want to discuss 10 instances in which belly pain originates from areas outside of the stomach or gut. The goal of this discussion is not to alarm, but to educate. Many patients come to me after reading online articles that suggest serious conditions, even cancer, based on common symptoms. While anxiety-provoking, the reality is that most abdominal pain is not cancer, but other causes, some minor, some more serious, should always be considered. Before diving in, it's important to understand that pinpointing the source of abdominal pain involves considering multiple variables: your age, the location of the pain, how long it lasts, whether it's constant or intermittent, and your medical history all influence the diagnostic approach. With that context, let's explore these 10 causes of abdominal pain that are not related to the stomach or gut. 1. Shingles. Shingles is a viral condition caused by the reactivation of the varicella-zoster virus, the same virus responsible for chickenpox. Although it is primarily a skin condition, it can cause significant abdominal pain when it appears along the nerves of the abdominal wall. The pain often precedes the visible rash, which can be patchy, blistering, and follow a specific nerve pathway. Individuals who have had chickenpox are at risk for shingles later in life, and vaccination is recommended in the United States starting at age 50. Because the pain originates from nerve inflammation in the skin rather than the digestive organs, it can easily be mistaken for gastrointestinal discomfort. Recognizing shingles early can lead to more effective pain management and antiviral treatment, preventing complications. Risk factors include having had chickenpox in childhood, age over 50, weak immune system treatment and prevention. Antiviral medications can reduce the severity if started early. A shingles vaccine is recommended for adults over 50 in the United States. Recognizing shingles is important because it's a nerve-related issue, not a gastrointestinal one, and early treatment can reduce complications. 2. Abdominal wall issues beyond the skin. The abdominal wall itself can be a source of pain. Nerve entrapment, where nerves become pinched or irritated, is a common cause. This can result from previous surgeries, scarring, or even the stretching of nerves due to pregnancy or weight gain. Pain from the abdominal wall is often sharp and localized, differing from the diffuse discomfort typically associated with digestive problems. Recognizing these issues early is important because treatments such as physical therapy, nerve blocks, or minor procedures can alleviate discomfort. Location of the pain: upper right, upper left, lower right, lower left, or generalized. Duration and pattern: is it constant, intermittent, sudden, or gradual? Severity: is it mild, moderate, or severe enough to interfere with daily activities? Associated symptoms: nausea, vomiting, fever, changes in bowel habits, or urinary symptoms. Medical history: previous surgeries, chronic diseases, or family history of vascular or digestive disorders. 3. Pancreatitis. The pancreas, located behind the stomach, plays a vital role in both digestion and blood sugar regulation. Inflammation of the pancreas, known as pancreatitis, can cause severe abdominal pain. The most common triggers are gallstones and excessive alcohol consumption, though other factors can contribute. In acute pancreatitis, the organ becomes swollen and inflamed, sometimes leaking digestive fluids into surrounding tissues. Chronic pancreatitis, on the other hand, involves long-term inflammation that gradually impairs pancreatic function. Both conditions require medical evaluation. Because the pancreas is not part of the stomach or intestines, but is central to digestive processes, its inflammation is a classic example of belly pain that originates outside the gut itself. Causes include gallstones that block pancreatic ducts, excessive alcohol consumption, certain medications or medical conditions. Symptoms: severe upper abdominal pain, often radiating to the back, nausea and vomiting, fever in some cases. 4. Gallstones in the bile duct. Gallstones are hardened deposits that can form in the gallbladder. Occasionally, these stones migrate into the bile duct, a condition called cholelithiasis. This blockage prevents bile from flowing properly, leading to significant upper right abdominal pain, nausea, and sometimes jaundice. Blood tests and imaging are usually sufficient for diagnosis, and removing the stone typically resolves symptoms. Like pancreatic pain, the discomfort originates from structures near the digestive system, but not directly within the stomach or intestines. Symptoms: severe upper right abdominal pain, nausea or vomiting, jaundice, yellowing of skin or eyes. Diagnosis and treatment: ultrasound or other imaging tests, removal of the stone, usually via endoscopic procedures. 5. Kidney stones. Although kidneys are part of the urinary system, stones forming within them, or within the ureters that carry urine to the bladder, can cause intense abdominal or flank pain. Pain location varies depending on the stone's position, and while many patients experience back or side pain, others may feel discomfort in the lower abdomen. Kidney stones illustrate how abdominal pain can stem from non-digestive organs, and why it's critical not to assume that all abdominal pain is gastrointestinal. Symptoms: severe flank or lower abdominal pain, painful urination or blood in the urine, nausea. 6. Endometriosis and ectopic pregnancy. In women, reproductive organs can also be a source of abdominal pain. Endometriosis occurs when tissue similar to the lining of the uterus grows outside of it. This tissue can attach to the abdominal wall, bowel, or ovaries, causing inflammation, scarring, and pain. Diagnosis is often challenging, and treatment may involve surgery to remove abnormal tissue. Ectopic pregnancy, where a fertilized egg implants outside the uterus, often in a fallopian tube, can also cause severe abdominal pain. This condition is life-threatening and requires immediate medical attention. Both endometriosis and ectopic pregnancies highlight the importance of considering reproductive causes in cases of abdominal discomfort, especially in women of childbearing age. Ectopic pregnancy is a medical emergency where a fertilized egg implants outside the uterus, most often in the fallopian tube. Symptoms include severe abdominal or pelvic pain, vaginal bleeding, dizziness or fainting. 7. Aortic conditions. The aorta is the main artery carrying blood from the heart to the rest of the body. Abdominal pain can arise from problems with the aorta, such as an abdominal aortic aneurysm, where the vessel wall weakens and bulges. Although aneurysms may not always produce pain, they can be detected as a pulsating sensation in the abdomen and pose a significant risk of rupture, a medical emergency. Another aortic condition called aortic dissection involves a tear in the vessel wall, allowing blood to flow between layers. This can severely reduce blood flow to organs and is associated with intense pain. These vascular causes are uncommon but potentially life-threatening and illustrate how abdominal pain can originate from structures entirely separate from the stomach or intestines. Abdominal aortic aneurysm. The artery wall weakens and bulges, sometimes causing a pulsating sensation in the abdomen. Rupture is life-threatening. Aortic dissection. A tear in the aorta's wall allows blood to flow between layers, reducing blood flow to organs and causing severe pain. 8. Mesenteric ischemia. Mesenteric ischemia occurs when blood flow to the intestines is reduced, often due to atherosclerosis or blood clots in the arteries supplying the gut. Insufficient blood supply causes the intestines to signal distress, commonly through abdominal pain after eating. Because the pain stems from a vascular problem rather than the digestive organs themselves, recognizing the condition early is critical to prevent serious complications like tissue death. Symptoms: cramping abdominal pain after meals, weight loss due to fear of eating, possible nausea. 9. Blood clots in the veins. Veins in the abdomen, including the portal and splenic veins, can develop blood clots, causing abdominal pain. Clots may result from inflammation, liver disease, or clotting disorders. Acute cases can be treated with blood thinners, while chronic cases may be more difficult to manage. These vascular problems again highlight that abdominal pain can originate from circulatory issues rather than digestive organs. This can result from liver disease like cirrhosis, inflammation, blood clotting disorders. Treatment: acute clots, blood thinners. Chronic clots may be harder to manage. 10. Peritonitis and diabetic ketoacidosis, DKA. Peritonitis is inflammation of the peritoneum, the thin lining covering the abdominal cavity. Irritation from fluid, infection, or chemical exposure can cause severe, widespread abdominal pain. Although often secondary to other conditions, its presence is serious and usually requires immediate medical intervention. Lastly, diabetic ketoacidosis, DKA, a complication of poorly controlled diabetes, can also cause abdominal pain. While the exact mechanism is not fully understood, elevated blood sugar and ketone buildup trigger discomfort. Treating DKA by normalizing blood sugar levels usually resolves the abdominal pain, but this condition demonstrates how systemic metabolic disturbances can manifest as belly pain. Symptoms: severe, widespread abdominal pain, often sudden in onset. Abdominal tenderness, especially when pressing on the belly. Rigid or board-like abdomen in severe cases. Fever and chills indicating infection. Nausea and vomiting. Loss of appetite or bloating. Treatment: hospitalization is required in almost all cases. Intravenous IV antibiotics to treat bacterial infections. Surgery to repair underlying causes like a perforated bowel or ruptured appendix. Supportive care, IV fluids, pain management, and monitoring of organ function. Key point: peritonitis is a medical emergency. Early recognition and intervention are crucial to prevent widespread infection, sepsis, and life-threatening complications. Conclusion: abdominal pain is a complex symptom with many potential causes beyond the stomach and intestines. Skin conditions, nerve problems, reproductive disorders, vascular issues, kidney stones, and metabolic complications can all produce discomfort. Understanding these possibilities helps both patients and clinicians approach abdominal pain more effectively. Persistent or severe pain should always prompt a medical evaluation. Early recognition and treatment can prevent complications and ensure the correct underlying issue is addressed. By keeping an open mind about the potential sources of belly pain, patients can better describe their symptoms, and healthcare providers can deliver more accurate diagnoses and effective treatments. Awareness of these 10 causes ensures that abdominal pain is not misattributed and that serious conditions are not overlooked.